From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, Southern Kentucky, those of you as far west as Jackson, Tennessee, and those of you in Columbia who have been coming through in big numbers. Welcome to a special holiday edition of Pharmacist on Call with your host, Dr. Shawn Pruitt. And if you are watching this show, I am your community pharmacist. Everyone, welcome to our December holiday special show. But you know what that means? This is our marijuana show. So call in with those questions and those comments, and certainly your opinions. We'll be talking about a variety of issues surrounding medical marijuana. But first, let me explain to the people who are new to the show. This is your 1 hour forum. This is your opportunity to call in with those questions and those comments, because your doctors are busy and your pharmacists are busy and they don't have time. For this hour, I do. This segment is sponsored by Pruitt's Discount Pharmacy, which is the pharmacy choice for the uninsured, and the Kangen Water Store of Nashville, Nashville's cleanest source of premium alkaline water. So before we get started into the show, I wanted to do some shout outs as we do. Wanted to give condolences to the family of Carl Owens. If you all remember on the last show, he was pretty much in hospice stage, and he passed away shortly after the show that we did. He's a gentleman in our commercials with the gold chain and the gold tooth, pretty much the personality. So pretty Carl Owens, saying goodbye to him and praying for his family, and that's Mrs. Owens, Carl, and Brian, his sons. So wanted to say goodbye to Carl. Wanted to get into some congratulations. I wanted to congratulate my daughter. She did the standardized test in Mississippi and scored a perfect score on the English portion. So great job, Shawn Pruitt. Keep doing great things down there. Also wanted to send a big congratulations to my baby brother, who was just recently wed to his girlfriend, Carla Robertson, who is now Carla Robertson Hardy. So congratulations to both of them on their recent nuptials, and welcome to the family, Carla. I also want to do some birthday shout outs. We've got Pastor Chris Hall, who is probably our longest serving technician, who was also in our commercial, and I think I brought him here on our anniversary show. So happy belated birthday to him. He's the pastor of Israelite Primitive Baptist Church in Murfreesboro, Tennessee. So just wanted to send a shout out to him. Miss Erica Jennings, another one of our technicians, a happy birthday to her. Let's see, we've got Tiara Hanna, who is also our senior technician, and she also owns Center of Attention Salon on Dickerson Road. So if you got any hair care needs, lady, make sure you go see Tiara. And Jade Reedus Wilson, who is our 4th year pharmacy student from Belmont University. She will be spending a month with us, and her birthday is in December. Oh, by the way, I'm a preceptor for Belmont University of Tennessee and for California Health Sciences University. So I take students on monthly for those universities and help train the students. So looks like we've got a couple of other birthday shout outs, but the phones are lighting up. So we've got to get into the calls because this is about you. All right, Christina, welcome to Pharmacist on Call. How may we help you?
Hi, yes, I've been a medical marijuana patient for a decade now.
Okay.
In California, and I've recently moved here to Tennessee, and now I'm without my medication, and they only want to prescribe opiates here, and I'm wondering, are they being educated about marijuana here in Tennessee, and are they at least, discussing it?
I would say no, they are not. And I think as legislation comes in the next spring and the next summer, that, they may begin to, but you have to understand you're in Tennessee, and certainly not as liberal a place as California, and some of the doctors are probably not going to be as open to change and open to new types of therapy, and they may have their own preconceptions about the use of marijuana for treating certain types of conditions.
Yes, and the cannabinoids. I know the cannabinoids without the THC is very helpful for inflammation.
Yes, ma'am.
And I'm wondering, the cannabinoids aren't even legal here, is it?
We're going to get into the whole legalization thing a little bit later, and so yeah, I'll speak on that as we go through the show.
All right. Well, I appreciate you bringing it up and opening the conversation here.
Yes, ma'am. Thank you, Christina. Welcome to Nashville.
Thank you.
All righty. Lee, welcome to Pharmacist on Call. How may we help you? Hello, Lee.
Hello, can you hear me?
Yes, sir, I can hear you. How's it going?
Oh, I'm good.
What's your stance?
Well, I had a question.
All right, go ahead.
Can you hear?
Yes, sir, I can hear you.
Hello?
Yeah, turn the volume on your television down there, Lee.
I got it now.
Okay.
I had a question.
Yes, sir, go ahead. Hello?
Hello?
Okay. Lee?
Yes, sir.
All right, go ahead.
I had a question regarding.
Okay, your phone is breaking up there, so I don't think we're going to be able to take your call. Try to call us back a little later here, okay?
I stuttered.
Oh, I apologize. Okay. Okay, go ahead. All right, we'll try you back there, Lee. Cynthia, welcome to Pharmacist on Call. How may we help you?
Yes, hello.
Yes, ma'am. How may I help you? Welcome to Pharmacist on Call.
Yes, my question is relative to good, healthy gut.
Yes, ma'am.
And I have a problem with my stomach just protruding, and I was wondering, do you recommend any kind of supplements or I know this thing with vinegar is supposed to be a big thing.
Yes, ma'am.
Now, it's supposed to be a good, healthy cleanse.
Yes, ma'am.
What do you recommend? Because I'm sure I have at least 7 or 10 pounds worth of stomach that I should not even have.
Okay, so we got a couple of things to think about. So if it is full of fecal matter, then we want to consider something like CKLS, which is a supplement called colon, kidney, liver, spleen. It's about 10 herbs, and they do a wonderful job of cleaning the gut out. So the premise is if they clean out the colon, that in turn will cleanse the blood of the kidney, the liver, and the spleen. So that takes about, in me, I use it takes about 15 hours to work. So you can go throughout your daily routine and you'll flush out when you're ready to get home that evening. So that's one thing we need to take into account. The other thing is if it's just, belly fat, then what we recommend is something called Garcinia cambogia, which is this product here. And what it does, it helps relieve body fat by decreasing the appetite, so you don't eat as much. It eliminates fat production at night. And so I believe the enzyme is called citrate lyase, by which it blocks fat production. And then the other thing is it has a mild antidepressant effect, so you don't have the tendency to binge eat because you feel depressed. So it picks up your mood. You don't want to binge eat, which gets us in trouble. We started doing the ice cream and all that other stuff. So you could probably look at both of those. Now, with the protruding stomach, let's make sure that our liver enzymes are okay, because that can also be a sign of liver damage or perhaps even congestive heart failure. So just make sure that those two things are not at play. And then you can go with CKLS and or Garcinia cambogia.
Well, how would you know which one would be the difference? I mean, how would you know which one it is, fecal matter or if it's fat?
Well, are you going regularly, like a couple of times a day?
Yeah.
Okay, well then I would just go with the Garcinia. And then of course you're gonna have to modify your diet some. The carbohydrates, you're gonna have to cut out all the good stuff like bread, pasta, that's right, the macaroni and cheese. Mm-hmm. Yeah, so all of that stuff you'll have to cut out, especially in the evening hours, which is when we, tend to make the fat.
Okay, and where are you located?
We're at 811 Dickerson Pike. We're about maybe a few hundred feet from those buffalo.
I know where that is. And how much is the Garcinia about?
$19.99, and this bottle will last you 1 month.
Okay, thank you so much.
Yes, ma'am. Thank you for your call. Okay. All right. Bye-bye. Hey, Lee. Welcome to Pharmacist on Call.
Hello.
Yes, sir. How's it going?
You caught me in one of my panic attacks.
Oh, okay. I'm sorry, sir.
Anxiety attack. Start stuttering.
Yes, sir.
Reason I'm calling it, my wife's on some of them. She was having some menopausal issues, and
Yes, sir.
I got her on one of them testosterone boosters, like a hormone.
Yes, sir.
I'm kind of perturbed at her doctor because he never said nothing about her growing a mustache and stuff, and she does.
And she has?
Yes, sir.
Okay, yeah, that's called hirsutism. And yeah, certainly it's going to be a byproduct of testosterone therapy. Have you spoken with him about maybe decreasing the dose of the testosterone?
Well, she's been on about 5 weeks, and we got to follow up. I think next Thursday. So yeah, we'll bring it up then. But it's just, I mean, I hate to sound shallow. It's a turn off, you know.
Understood. Yeah, understood. But it's something that she can shave.
And yeah, she could. But I don't know. She needs to wax it or something.
Yeah. Then that's an easy remedy. And then she still has her hormonal issues still dealt with.
You think he'll be able to decrease it?
I think he can. Yes, sir.
Did it? What's the name of most of them? Because what's the name that you would prescribe?
What is the name of the testosterone booster that they used in her?
Oh, it starts with Estra something. She ain't here now, or I'd ask her. It's Estra Max, it maybe, something like that. I don't know if it's herbal or what.
Okay, it sounds like it's not a prescription product.
Yeah, I mean, she done got back hair and the mustache and everything, and I guess it was just.
Yeah, I think I can understand the concern in your voice there. But again, yeah, see if they can modify the doses of the supplement, 'cause that's what it sounds like. And but like I said, if you just do something about the hair, you still got your wife there.
Yeah, that's true.
Yeah, so I tell you what, man, after you have that visit, make sure you call back into us and update us on how that situation's going.
All right, I will, Dr. Pruitt.
Okay, all right, good luck, Lee.
Hey, I really appreciate it.
Yes, sir. Well, I appreciate you calling. All right, thank you, Lee. Okay, everyone, we are up on a break. Stay right there. We'll be right back.